Hey guys, welcome to Kid Medic, and today we're going to be going over how to treat minor and major lacerations. I'm sorry I haven't been posting for a while because I've been very busy with a lot of things, but let's hop into it. So, whenever you're dealing with a laceration, you want to make sure everything's clean and sterile. That's why you should always be wearing either most likely sterile gloves, but for training purposes, we're going to be using these gloves. Now, whenever you have a wound like this, if there's severe bleeding, what you want to do, the first thing you do, you take and you press as much pressure as you can until the bleeding stops. Once the bleeding stops, you would take off your gauze pad and then you would flush it with sodium chloride. Open up, so we're not going to open this one since this one is not expired. But yeah, so we're going to simulate flush. So you'll take your 10 ml syringe without a needle, pop it, open it, and then remember you don't want to touch that part because that part is sterile, and never touch the tip because that is still a sterile field. So we're going to drop our sodium chloride, and you want to flush at a minimum of 3 times. So we're going to open up the wound and flush. That's once. Again, that's twice. Now, sometimes you may want to pour, which is highly recommended pouring, but if you don't have enough, this also works. But if you're pouring, it'd be something like this. Yeah, but now we have flushed for a minimum of 3 times, so we're going to kind of dab it up. And now, normally what you would do is you would use betadine or povidone iodine swab sticks to sterilize the area, but for these purposes we do not have that, so we're going to use some first aid antiseptic called benzalkanium chloride, 0.13%, which you can use on your hands to clean them and as a first aid antiseptic. So we're going to spray a little bit of this on there and on the inside. And then that antiseptics it. Now, if there were any debris in the wound or anything like that, what we would do is we would take our tweezers, we'd locate the debris, and we'd pull it out like that. I just pulled a little piece of tissue out as an example. So you could either use tweezers or curved Kelly forceps. Both of them work, but I'd most likely use Addison or Merriam forceps, or known as tweezers. Then what we would do is, as it's antiseptic, we dab it off again a little bit. We want to open up our wound and double check for any debris. Alright, and since there's no debris in that wound, what we want to do is we want to sterilely wrap it. So what we're going to do is we're going to take sterile gauze pads. If they're thin, you might want to apply 2 gauze pads. Now we have applied 2 gauze pads. Now there are 2 ways you can wrap it. Rolled gauze or ace bandage, and I'm going to demonstrate with the ace bandage. So what we're going to do is we're going to securely tighten it like that. And then we're going to tell the patient to lift their arm up. And we're going to wrap this tightly around the patient's arm. All the way around like so. But yeah, so then you tape it on there. Now, if this was a major laceration and there was high amounts of pain, what we would do then is same steps as first. Hold, compress, stop all bleeding. Now a major laceration, I'm talking like all the way to the bone. We would take a syringe, and now this time you really want to be sterile with this one. We take our syringe and follow our medication administration basics. Take off the top, draw in a little bit of our air, and then drop either 1 to 2% lidocaine. And now this is just training vial. This is not real medication. So we push in the air, And then we're going to slowly draw the desired amount, which I'm going to go ahead and do 3 mils so we can get all of the area, or however much that was. I don't think I did 3 mils. Now you want to make sure all the air is out, so we tap it, and then we push all the air out. There we go. Now what we do is, with the lidocaine, we locally anesthetize it, including the skin. Anesthetize the skin, slowly anesthetize. While we're pushing around like that, and then we get in the inner parts of the wound and just press around to numb the muscle so that the patient doesn't experience pain. And then you would throw this in your biohazard. And then same steps as usual. Apply the gauze. No, apply the antiseptic. And now this time, if you wouldn't want to flush with sodium chloride, you want to flush with sodium chloride and povidone iodine bottles to wash the wound. But for right now, we're going to antiseptic it. Let's say we're flushing it. 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 With big bottles to get all the stuff out. Let's say we flushed it for 3 times. We take the gauze. We place it on there. And then we wrap. Now, normally I don't have sutures right now or zip stitches, but in a hospital environment, you would most likely want to suture this or a massive laceration. And then you would apply a tegaderm. And then, as usual, just wrap the gauze bandage, around the arm. But that's the basics for minor and major lacerations. Now, of course, if you're in a home environment, you would want to do something else. But let's say we have a puncture room, and I'll make us a puncture room real quick. Let's say let me make a puncture wound. Let's say we have a puncture wound. Well, you can't really see it, but let's say we have a puncture wound where there's something still stuck in the puncture room, like forceps. Number 1, do not pull it out, because if you do, it could have hit an artery, it could have hit a vein, it could have hit something, and it could be stopping that bleeding. So if you pull it out, it could start bleeding, which could be fatal. So what we want to do is we don't want to touch it. We want to call 911. And all we want to do is we want to just wrap it like that, keep it straight in there, hold gauze and pressure. Now, in a hospital environment, the most likely thing they would do is they would have an electrocautery surgical device, which is an electrocautery device is where it like burns your blood vessels so it stops bleeding. They would apply a very tight tourniquet to right here, and then what they'd slowly do is with pressure, very slowly pull it out, and then immediately gauze it. And then keep the tourniquet on, open it up, and take the electrocautery device and burn all the blood vessels closed. But that's what I believe that they would do. And then they would dress it and everything, dress it as usual, put it on the gauze. But if you're at home and you're not in a proper environment, and even in an ambulance, they most likely don't pull it out. But yeah, that's everything on major and minor lacerations and puncture wounds. But if it was a minor puncture wound like that, you could just take out and it was still stuck in there and it wasn't that deep, you could just take it out and put some pressure on it, a Band-Aid, a little triple antibiotic, and then it'd be fine. You wouldn't have to necessarily flush it. But that's everything on major and minor puncture wounds. Thank you guys for watching. Make sure to view our website. We just did an update, and bye!